Leader of the third party.
Thank you, Honourable Speaker. I rise to speak to Bill 41, Restricting Public Consumption and Illegal Substances Act. I've listened with interest to the Minister's introduction of the bill at second reading and to the members of the official opposition who have spoken to it today. It is not a straightforward or particularly easy topic to speak to. And we've heard a lot of somewhat inflammatory comments today, and I am hoping to be able to speak a bit more to data than anecdotes when we talk about this topic. The minister, when he introduced second reading, said, "This is a health matter. We have to approach it with compassion and empathy. The government has spent $1 billion. The government has heard concerns, particularly from local governments, about public drug use, and that people want to feel safe." And then the minister said that the legislature will treat decriminalized drugs similar to tobacco and cannabis. However, at that point, I'd like to point out that people aren't dying from a single use of tobacco or cannabis, as they are from unregulated and highly poisonous illicit drug supply. And he indicated that they would be asked to leave the area where they're using and go to an overdose prevention site or safe consumption site. Were it to be so simple, Honourable Speaker, there just simply isn't that kind of infrastructure that exists in BC at this point. I want to start by speaking to the decriminalization pilot project that is underway in BC. And one of the main goals of this project was to destigmatize people who use drugs. It's unfortunate that even in this debate, we've heard comments that are certainly stigmatizing of people who use drugs. We've seen historically the harsh impacts of prohibition. The stigma and the shame associated with substance use has pushed many people to use alone, where we know the majority of deaths occur. By walking back decriminalization without robust services and spaces for people to consume substances safely, we're doing the opposite of the intended goals. We're perpetuating the narrative that drug users are scary and dangerous. And without accessible safe consumption sites in every jurisdiction, this bill is simply pushing people who use drugs out of sight. As a historian, I always like to look back at the context and what got us to a place like this. In 1876, the Canadian government introduced the first Indian Act. After dispossessing and destroying the homelands of so many Indigenous communities, those remaining were forced onto reserves. Their movements were restricted, and a pass system was used for any Indigenous people who sought to leave designated areas. This system replicated a similar story that unraveled across countless areas around the globe as a result of colonization. A narrative persisted that there were groups of people who were classified as undesirable. They were forbidden from entering places in which the dominant and privileged society occupied. This narrative has continued to persist today, from the reserve systems to the movements to incarcerate and punish certain classes of people. Think back to Japanese internment camps, the various phases of the Chinese head tax, and more recently, the role that institutions have played in removing people with mental health issues from the body politic. During Expo 86, over 1,000 people were evicted from their homes in the downtown East Side with barely any notice. These low-income residents were removed from their homes without anywhere to go, to make way for the millions of visitors coming to experience Expo 86. Dispossession and displacement have a long history in this country and in this province, built on a narrative that there are people who do not deserve the same rights to home, freedom, security, safety that others have. In Vancouver in the 1970s, the communities of Hogan's Alley were faced with similar displacement. Hogan's Alley was a vibrant, diverse community of predominantly Black residents and businesses. This community was destroyed for the creation of the Georgia Viaduct. Throughout much of North America, quote, urban renewal pushed mostly communities of color out of their homes and communities. Displaced and dispersed, these communities fractured in the name of urban renewal and progress. Our province, this country, have a long history of displacing and dispossessing people of their land and homes, and it is crucial to recognize this history, to understand this narrative being continued in this bill. This legislation appears to recreate and amplify the same narrative that there is a class of people who should not be occupying public spaces. I'm concerned and have heard concerns from bylaw officers and police officers about the confusion that this bill will create, the onus it puts on police, and the extreme discretion of police that this legislation justifies. For over a century since the banning of opium, the law enforcement bodies of this country have been instructed and obligated to crack down on Black, Indigenous, and people of color. Reports, inquiries, commissions, Supreme Court rulings have raised the critical issue of the overrepresentation of Indigenous people in carceral systems. A Statistics Canada report detailing the incarceration rates of 2021 and 2022 found that Indigenous incarceration rate is about 9 times higher than that of non-Indigenous people. First Nations people represented 15.4% of toxic drug deaths in 2022, and yet comprise only 3.3% of BC's population. The aim of Decriminalization pilot project is to destigmatize people who use drugs by recognizing the long, fraught, and complex history of substance use. The provincial and federal governments committed to try to change the stigma that hard drug use has surrounding it. A Pathway to Hope, published in 2019, in the Pathway to Hope, the Ministry of Mental Health and Addiction states, quote, research suggests that stigma prevents 40% of people with anxiety or depression from seeking help, a trend that is magnified when put under a lens of cultural, gender, ethnicity, age, poverty, and sexual and gender identity factors. In the case of substance use and addiction, given the negative view society has about people who use drugs, the stigma and multiple barriers to access care can be even more problematic. The Decriminalization pilot project is a key aspect in destigmatizing people who use drugs. In the Stop Overdose campaign, the ministry states, quote, often, people are unable to access life-saving supports and services because they are worried about being arrested or having their drugs seized if they reach out. By decriminalizing people who use small amounts of drugs, BC aims to break down barriers that prevent people from getting help. I won't disagree with members of the official opposition who pointed out that in bringing in the decriminalization pilot project, the government didn't do the work necessary to ensure that local governments understood and had the supports and services available in their communities, and that there was the infrastructure already in place to support people. What we heard over and over again in the Health Committee, which was a committee that had more input than any other committee in BC, was that there aren't the supports, there isn't the infrastructure, that there aren't safe consumption sites, that there aren't access to services and supports available to people in this province. The introduction of this legislation creates renewed stigma. Peers and people with lived experience have stated that Bill 34 galvanizes the belief that drug users are a dangerous class of people, and as they are undesirable, they should not be permitted to occupy public spaces with the same level of dignity afforded to others. Specifically, this legislation targets unhoused community members. It is not dissimilar to the narrative of mandatory treatment. Both are glaring examples of policy goals that do not center the people most affected. It's clear this legislation is not a matter of listening to and helping people who use substances or people with mental health challenges. It's a matter of trying to push these people out of sight. And I think we need to be honest about the role that politics is playing. We're willing to point at people who are the most marginalized in our province and then say we just need to solve that problem. These people are in these situations because government has failed to address the root causes of these problems: ever-growing inequality, lack of affordability, a growing housing crisis, unaddressed mental health and trauma, lack of care and belonging in society. This is an example of legislation that is aiming to respond to a symptom of a growing number of intersecting crises rather than the crises themselves. Politicians are okay to direct anger and resentment towards the most vulnerable. The world we should be striving for is one in which there is no homelessness, where people don't need to use in public spaces because there are enough safe consumption sites, where people feel a part of their communities, where they can access the supports they desire when they want. These people have fallen through ever-widening cracks of the social safety system, a net that has become a high wire, and it's scarring. When somebody loses housing, loses a community member, a family member, a friend, when they experience trauma or violence, when they are unable to find shelter, at each loss there is scarring, and people get to the place that the scarring is so deep that it's hard to function. And drug use can be a response to that scarring and the brutal circumstances that people are facing. I've heard from people in my community who've said to me, until I had a secure place to sleep at night, my only two questions throughout the day were, where am I sleeping tonight? Where am I getting my drugs? The fact that we are not reckoning with the impact that it has on people to not sleep. I've brought this up before, but the lack of sleep, the lack of the ability to sleep safely, securely, to know that you can go to sleep and that you're not going to be hurt or assaulted or robbed. This is not just a basic human dignity. This is a human need. It is a human right. And we are not meeting that human right in BC in staggering numbers. I want to hear others in this house reflect on what it does to a human being to not have the security to sleep at night, or being forced to sleep in a place that is unsafe. People who use drugs are not bad people. Challenging circumstances, unresolved mental health and trauma, addiction, lack of housing, and poverty are all compounding factors in a toxic drug crisis that, as we've heard over and over, has killed 13,000 people since the emergency was declared in this province. It's become normalized for this many people to die in our society. How did we get there, to hear the death toll and take no action, to to essentially have no response now, month after month. We are a province that does not have enough safe places to go, that does not have enough safe consumption sites. Some communities have nothing. Overdose prevention services that meet people's needs are essential. Since 2017, inhalation has been the primary mode of consumption for drug poisoning deaths, not injection, smoking. This year alone, over 65% of drug poisoning deaths were caused by inhalation. And yet, throughout this province, there are only 19 safe consumption sites that accommodate smoking. So when the minister, in introducing second reading this afternoon, said that people would be encouraged to move along and go to a safe consumption site, there are only 19 of those in the entire province that can accommodate people who use their drugs by smoking them. 19. The Chief Coroner of BC, Lisa Lapointe, has regularly stated that the criminalization of drug use has failed at all levels. There's no evidence that there has been an increase in substance use in public places listed by this legislation. We hear a lot of anecdotes. And yes, absolutely, as a parent, playgrounds absolutely want to be a safe place for my child and my children's children eventually. But it's not drug users that we have to point to when we see people feeling unsafe in their communities. It is the fact that we collectively, as a society, have created these gaps in our social safety net that are so huge that more and more people are falling through them. That's why we feel unsafe. That's what people, of course, are upset seeing this glaring poverty, this glaring need in our communities, in our cities and towns. Of course, we are all upset by that. But blaming the people who have been failed, that's not the solution here. The contents of this bill also do not reflect the recommendations of the All-Party Health Committee. The All-Party Health Committee committed to listening to and learning from experts, from people with lived experience, and people working on the front lines. It was powerful and devastating to be a member of that committee. To work alongside my colleagues, work towards devising solutions that we could all agree to, that we could present to the government and say, you've got all parties on side. You can move. Go. We heard time and time again that we needed to approach this crisis differently because what we've done so far has not been working. The Health Committee's final report was released in November of 2022. It included 37 recommendations on how to address the drug poisoning crisis. Those recommendations included, number one, rapidly scale up a flexible, evidence-based, low-barrier, comprehensive continuum of care that spans the social determinants of health, prevention and education, harm reduction, safer supply, treatment and recovery, and includes housing, employment and income, and mental health supports, defined goals, metrics and timelines, clear accountability mechanisms, and regular reporting on the results. Another of the recommendations, fully integrate people who use or who have used drugs into the development and implementation of new policies and programs that directly impact them and their peers, including youth, 2S LGBTQIA+ people, Indigenous people, rural and remote residents, parents, people working in the trades, in transportation, or as equipment operators, people with mental health challenges, and people who are experiencing homelessness. Recommendation number 6, increase funding for an expanded, affordable, and accessible continuum of housing options for individuals at all stages of substance use, including supportive housing programs that provide wraparound supports, and develop a toolkit of best practices for supportive housing initiatives to ensure success and community support if we want our communities to feel safer. And I think we all agree on that. Make them safe for everybody, including people right now who feel the most unsafe, I will argue, and that is people who are unhoused. 9, recommendation number 9, urgently ensure the availability of province-wide standardized in terms of resourcing, operating, and evaluating parameters harm reduction services, including overdose prevention and drug checking services, and develop community building measures to overcome local opposition. One example of a solution in real time that addresses these multitude of issues is the Village Project in the Cowichan Valley. I was there this morning with the Minister of Mental Health and Addictions, hosted by the mayor and the operators of the Village Project, Lookout Housing, and Cowichan Housing Association. 35 pods in 3 groups, so 12, 12, 11. Everybody has their own sleeping pod. The door locks, the window opens. There's heat. There's a table, a desk. And then each pod has a collective eating area, shared bathroom facilities, shower facilities. Staff on site 24 hours a day. And meals provided. Pharmacists visit several times a day to meet the needs of people, healthcare. And one of the things that we heard this morning, and I've heard several times about the Village Project, is that for people to begin to be able to access the services that are available, the Village is an example of where those services can come to the people where they're at. The visits that I've made to this site, there's a real pride, the people that are working there, about the success of the residents. And there's a real hopefulness that this is now a proven project. It's demonstrated to be successful. Kelowna and Campbell River are looking at it as a project that they want to take on, as a model they want to take on. But it's more than just providing housing. It's providing stabilization, it's providing access to healthcare. It's a recovery approach to meeting people's needs. And I think in communities all across BC, government should be scaling up its funding to the providers that can demonstrate that they can replicate a model just like this. People go from sometimes years or even decades of being unhoused, succeed at the Village Project, and then move into other forms of housing. And it's culturally safe. The elders from Cowichan tribes visit the site. There's ceremony. And the approach is informed by the residents. So it's not a one-size-fits-all, but it really takes into account that these are human beings, whole human beings. And to be treated with dignity and respect and compassion can go a long way for a person who's been lacking that in their lives. We know as well that a large number of people who are going to be affected by this legislation are in fact people who have already been failed by government, that youth who age out of care have an extremely high rate of homelessness, are at risk of drug use, are at risk of incarceration. And I think it's really important for us to recognize that a lot of people that we see have been failed by multiple systems, have often been failed specifically by a government system that was meant to protect them and did the opposite. And this is why I really worry about some of the rhetoric that we're hearing around drug use right now, because it takes us back to a place of stigmatizing, of blaming people, of dehumanizing. And we can see the truly deadly outcomes of that approach. One of the things that we've been calling for, and I hear the opposition, I'm the designated speaker as well on this. Thank you, Mr. Speaker.
Thank you, Member.
We've heard from the official opposition about the need to scale up treatment. And yes, that is absolutely an important goal and outcome. But I will argue, and I will go back to the 2016 Death Review Panel and the coroner's recommendations then, that we should not scale up anything until it has been properly regulated and until we can be assured that what is being offered as addictions treatment is evidence-based. Because right now, and the coroner pointed this out and has pointed it out over and over again, anybody can hang up a shingle and call themselves an addictions counselor or offer addictions treatment. They don't need to have had any training. They don't need to have any evidence that their program is going to be successful, and they do not need to provide any data as to whether it is successful. And so we are further putting at risk people who are already underserved by government, to say the least, and by society. And so I really strongly urge this government to take those recommendations. 8 years now that the coroner has been making this recommendation and this call, to ensure that what is generally agreed to, there's been declared a health emergency. If we are taking a healthcare approach to this, which we should, I don't think any of us would be comfortable seeking healthcare in any other facet and thinking nobody is regulating the delivery of this healthcare. That the person providing me with a service that is being called healthcare has no responsibility and no oversight as to whether that service is going to help me or harm me. And I think that this is absolutely a critical and essential step that this government needs to take, and to take it very seriously. The BC Centre for Disease Control data indicates, this is from 2019, that between 156,000 and 221,000 people use unregulated substances in a given year. Almost 250,000 people in BC using unregulated substance. And that's from experimental use to social recreational use to regular use. And when we talk about substance use, often in here in particular, we're generally talking about people who have substance use dependency or who are using substances regularly. And yet, we know that for a number of the people who die every year in this province, they are not regularly using substances. A lot of them, it might be the experimental, and for others, it might be the recreational. And I think that it's really important for us to keep that data in mind when we're talking about this issue. Other data from the BC Centre for Disease Control, next door to us, Alberta, which has not embarked on a decriminalization pilot project as we have, the overdose mortality rates are essentially the same as BC. I think that's really important to keep in mind with the rhetoric that is happening. The other piece of information and data that has come, which is that since March 2020, there's no significant increase in people being newly diagnosed with an opioid use disorder in BC. There's no significant increase in hydromorphone-only drug toxicity deaths in BC, and no relationship, according to BC Centre for Disease Control, between hydromorphone dispensation volumes and new cases of opioid use disorder in BC. So it's really important that we look at the data and the information that's available to us to ensure that we are stating accurately what the reality is in British Columbia. Rates of new diagnoses of opioid use disorder among youth under 19 are low compared to other age groups, and in fact declining in the last year. Prescription opioid dispensations have been declining in BC since 2011, and defined daily dose of high-potency opioids per 1,000 persons declined 49.5% in BC between 2011 and 2018. Considering the use of substances in this province, I think one of the things that's really important and has been documented is the rise of the use of crystal methamphetamine. It was the most commonly reported substance use since 2019. And that the deaths in BC continue to be driven by fentanyl, but also by now there is a lot of polysubstance use, benzodiazepines and stimulants in the illicit drug supply, which are very dangerous. I bring this data and evidence from BC CDC because I think it is important for us as elected representatives to evaluate policies and ensure that government is making decisions based on evidence and science. The evidence in the report from BC CDC finds that most persons who've had a fatal overdose were not engaged in treatment, did not have a diagnosed opioid use disorder, and that more people are dying of smoking than ever. Prescription opioids prescribed safer supply are not primary drivers of the unregulated drug poisoning crisis. It is the unregulated street supply that is killing people, and there are not nearly enough places to consume substances safely throughout this province. One of the things that we heard over and over again during the Health Committee was how easy it is to access the illicit drug supply in this province. It is, we heard that from everyone, from medical health officers to people with lived experience. It is unbelievably easy and terribly easy to access the unregulated, illicit, very poisonous drug supply in this province. And that should be a concern. We've done collectively a lot of work, Honourable Speaker, to create plans and solutions on how to address this crisis, but this legislation does not reflect the science, the history, nor the recommendations of the All-Party Health Committee. Our questions include who was consulted in forming this legislation. People with lived and living experience with substance use have raised serious concerns about how decriminalization was approached in the first place. And it appears the government is not making decisions based on science, nor the people who are more directly impacted by the drug war, the drug poisoning crisis, the war on poor people, and the housing crisis. We're told one story, that unprecedented work has been undertaken to address this crisis, and yet, still every day, 6 people are killed by a toxic drug supply, and it has become normalized to see this drastic and dramatic loss of life. There are many facets to this problem, and we won't fix them all immediately. But if we can agree that what we don't want to see is public drug use, that is something that can be solved, but not through this legislation. We need safe consumption sites available and accessible in every community, and these services must meet people's needs where they're at. No jurisdiction has arrested their way out of this problem, and we heard that on the committee. We heard that from law enforcement, that we will not arrest ourselves out of this crisis. Until these necessary and reasonable supports are in place, we can't support this bill, which isn't good enough to save the lives of people dying in record numbers in British Columbia every single day. I think it's really important for us to recognize that what is being framed as a drug problem is actually, in many cases, a poverty problem. And that poverty problem continues to grow in this province. And until we address the human right for housing for everybody, we are going to see this growing sense of insecurity pervade all of our communities. And that insecurity can only be solved by us collectively agreeing that we can and must meet people's basic needs in this province. We absolutely can. It's not that there isn't enough to go around. And I want us to recognize, and I think we can all agree on this, that we should and must be a province that does not accept homelessness as just a natural offshoot of our economy or part of what happens when we let market forces take over our housing. Homelessness and the deaths that we're seeing from the toxic drug crisis are policy choices. And so it's our policy choices in here that are necessary to solve these crises. Thank you, Mr. Speaker.